When you first start NMT here at NMTSA, your therapist will need to assess you. This might include administering standardized assessments, doing less formal non-musical assessment, maybe activities like having a conversation, playing, doing some movement, walking, watching you walk. And it might include music listening, making music. And throughout this process, the therapist is trying to determine, first of all, where are you at? And second of all, what are the best uses of music to take you where you would like to go? Often the music therapist needs to see how a given skill goes without music before adding music into the mix. So it might seem a little weird, like I'm here for music therapy, and then the therapist is playing catch with your child or just asking about your life. That's normal. We need to have a good idea of how you're functioning without music before we see if music can make a difference for you. Now, you might come to therapy with a really clear idea of what you would like to work on. In that case, we will almost certainly work on that with you, but we might also assess in a few other areas just to make sure we've narrowed in on the most efficient use of music. One really common example is that a parent might bring their child to therapy to work on social skills, but the therapist might discover there's underlying needs in sensory processing or attention. Then that's really interfering with the social skills. So the therapist might choose to set an attention goal or a sensory processing goal rather than jumping all the way to social skills when there are interfering variables. If you are bringing a child or a loved one to music therapy, there's the decision of whether you will wait in the waiting room or whether you'll come back to therapy. You might come back to therapy if your child or loved one is not used to being apart from you, or if they need you on hand for physical assistance for safety or medical reasons. You might choose to wait in the waiting room if they're used to attending therapies or school without you, or if independence is a goal of yours, or if you feel like the one-on-one relationship with the therapist is going to be really important. And then from that point moving forward, you and the therapist will work to determine whether you need to be present, and if so, how much. For example, the music therapist might decide to recommend a home program. Some things are better implemented regularly and at home, and so in that case they might ask you to come back to therapy in order to receive training on how to implement the home program. And the initial assessment period might last a period of several sessions. It just depends on the complexity of need and how long it takes to collect all the relevant information. Your therapist will almost certainly want to email or talk to other members of your treatment team, read reports, and just get a complete picture of the person that they're going to be working with. So yeah, those are some things to expect for assessment, and we look forward to partnering with you.